Has Premier Kenney learned from his pandemic mistakes? Does he think more private healthcare options should be offered now to help a beleaguered healthcare system? Let's find out. Joining me now is Alberta Premier Jason Kenney. Premier, good to have you back on the program.
Good to be back, Evan.
Look, there's lots of concern about if this has peaked or not. In your province, hospitalizations due to COVID-19 surpassed 1,000 for the first time since mid-October. There's makeshift beds for some of the people. You got about, 5,500 Alberta Health staff out sick every day. Surgeries are delayed. Boy, it looks tough. Why have you said the peak is past? Maybe things are still very serious to come.
Yeah, well, it is a serious situation, but I believe we have passed the peak of transmission. Our positivity rate seems to be coming down sharply, and our wastewater data shows declines in COVID in 15 of 19 communities where we track it. And as you know, Omicron around the world has typically been a 4-week wave. So I think we're starting to come down. We'll be going up in hospitalizations with the lag effect that we all know about for the next probably week or two. And thankfully, because of the lower severity of this variant, it's putting relatively less pressure on the intensive care, which has really been our sensitivity in Alberta. So, there's going to be some difficult days ahead still for our healthcare workforce, but it is, I think we're going to be able to manage to get through this.
Okay. You didn't put in the same kind of restrictions that some of the other provinces like Ontario and Quebec did. Are you worried that you are going to downplay the seriousness of COVID as you did in that best summer ever, which you've apologized for, and that was optimism trumping science? Are you worried about that again?
Well, no. By the way, Evan, we took advice from our medical experts on public health experts on the approach of moving to endemic management in the summer. It turns out with Delta and its severity that we were under-vaccinated. And the key factor here, Evan, is vaccination. We have gone from about 75% to 90% first dose coverage amongst adults. We've caught up. We were 10 points behind, but we've now caught up with the national average on vaccinations. And quite frankly, we are seeing, together with Saskatchewan, the two least restricted provinces in the country, so far on Omicron, we are seeing significantly less pressure on the hospitals than Ontario and Quebec that have had far more stringent restrictions.
You've caught up on first doses in Alberta, but third dose or booster shots, which have proven to reduce hospitalization. So that's a real key weapon in protecting the healthcare system. Alberta's behind the national average. It's some of the lowest in the country. You're lagging behind. We're 27% in Alberta, right? The national average is close to 30. Ontario's 33. Why is Alberta lagging behind, and what are you going to do to increase it?
We've done everything we can. I think we were the first province that came out with a vaccine lottery. We have spent millions of dollars promoting the safety and efficacy of vaccines. We have a proof of vaccination program for people participating in discretionary, higher risk activities, et cetera. At the end of the day, though, it's people's choice. And I think what we're seeing in Canada, not just Alberta, on the booster shots, frankly, with a lower uptake than I expected, is just, Evan, I just think a lot of people, in a way, are checking out. Like, they're just not organizing their lives around COVID anymore. And I will continue to urge people to get that booster shot. It can really be helpful in keeping them from severe symptoms and hospitalization. But at the end of the day, it's a free society. And I think what policymakers, what we've all got to come to terms with is, how do we move out of Omicron and gradually, carefully, learn to live with this thing, because this disease will be with us in different variants for some time to come.
The federal government has floated the idea that provinces should talk more about mandatory vaccines. What is your solution if the unvaccinated take up a disproportionate number of hospital beds and ICU beds? What do you do about that?
I think it's really, well, listen, you're right about that latter point. And it's an important message to convey to the unvaccinated that their personal choice also is a social choice with broader consequences. 70% of our ICU COVID patients are unvaccinated, from 10% of the adult population. So the surgery postponements and cancellations of medical procedures, much of that comes from those individual choices. Now, having said that, Evan, this is still a free society. And the idea of violating somebody's bodily autonomy to force them to be injected with something against their will, I think is clearly unconstitutional. We have to do everything we can. But in Alberta,
no one's
we have
done that, just to be clear, right?
The long-standing legal power of government to impose a mandatory vaccination. Go ahead, sorry.
Sorry, I'm just saying, no, I just want to be clear. No government is, there's no mandatory vaccines. There are carrots and sticks, and there are some pretty big sticks now in Quebec, which they're talking about a tax.
Sure. Evan, I really think that is contrary to the whole idea of a universal public health care system, to start sending people a bill because we disagree with the choices that they've made. Well, the moment you walk into the hospital, it's a judgment-free zone in terms of the choices people have made. You provide them with care, medically necessary care. That's, I think, a Canadian and certainly an Alberta value.
Okay. Here you are championing the idea of universal health care and accessible, but you also floated the idea, because there's surgical delays in Alberta, as you know, of surgeries at private clinics to alleviate the burdens. What do you mean by that? Because you know, as soon as you say, let's do private clinics for surgeries, two-tier health care, Jason Kenney is trying to have it both ways, protect the universal health system and also open the door for private health care.
It's not two-tier care, Evan. We're talking about massively expanding the numbers of surgeries that we perform, which are publicly insured, no cost to the patient. But surely, Evan, we've got to come to terms with the limitations of the Canadian healthcare system that have been spotlighted through COVID. The fact that we have one of the most expensive systems in the developed world with some of the poorest outcomes, with some of the lowest availability per capita of ICU beds and other hospital beds. This is not acceptable. If we can have privately operated surgical facilities funded by the government through Medicare, provide those at lower cost and more efficiently, because they know how to use capital more efficiently than big government hospitals, then why shouldn't we do that? We're funding it. We put $1 billion in our last budget for this surgical initiative.
Premier, look, every time the premiers meet with the Prime Minister, they ask for more money for healthcare. There's real needs for more money in the system. I get it, but you know that's a song that provinces have sang for a long time. But you still, sir, need to pay for healthcare. It's provincial jurisdiction. Some say Alberta is the only province without a sales tax or an HST to help pay for things that are provincial responsibility, like healthcare. Every single other province has one. Will you consider some kind of HST or sales tax to help pay for the healthcare the citizens need?
No, Evan, the problem isn't Alberta being undertaxed. For goodness sakes, we contribute net. I mean, COVID was an exception, but over the past 20 years, we've been contributing $20 billion more to the federal treasury than we've gotten back in benefits and transfers as individual Alberta taxpayers. So we help to subsidize healthcare transfers all across Canada. Alberta is not the problem. We in our economy are the solution in some respects. We need common sense reforms, but we also need additional funding. Getting us up to 35% federal share of healthcare costs, which is what the provinces are asking for, would be worth over $3 billion coming back to Alberta taxpayers, so we could help to fund that.
Premier, the federal government has a mandatory vaccine mandate for cross-border truckers, as you know, and this weekend the U.S. had the exact same policy. So now on both sides for cross-border truckers, there has been concern that this would sideline between 8,000 and 12,000 truckers. You have said you're against the imposition of this, but the U.S. has it now. Why are you against the imposition of this? I think it's about 9% of truckers are not vaccinated.
Well, just because the Americans are doing it doesn't mean we should shoot ourselves in the foot, first of all. Secondly, we should be vigorously lobbying Washington to delay the implementation of that. I understand that there can be, in some cases, a legitimate argument for vaccine mandates, as we've done with our hospital workers, with a rapid test option. But we should also apply this with a heavy dose of common sense, Evan, because we already have serious supply chain challenges. There are grocery store shelves across the country that are going empty. We're dealing with huge inflation. And taking 10% of the truckers off the roads, bringing groceries from the U.S. to Canada at this time in the winter makes very little sense, particularly when it's not going to have any measurable benefit in terms of viral transmission.
Okay, I got to leave it there. Alberta Premier Jason Kenney, thanks for joining us.
Thank you very much, Evan.